Hello, hello, hello. We are live at the Central Arkansas Women's Expo. I wanted to get on here and just kind of show some of the discussions that we've had today. And I'm going to turn my camera around, or try to turn my camera around because this is backwards. Figure out how to turn the camera around so it's not backwards. So y'all can actually read my lecture. Well, hello. If you are here and you got to see us, comment below and just let me know what you thought about the session today and how everything went for the Central Arkansas Women's Expo. Also, if you know how to flip the camera around, let me know that so I can flip it so you can actually see.
We might have to flip it and turn the phone.
Oh, okay. So Kennedy's going to help me kind of flip it so y'all can actually read the lecture. See y'all can see our little discussion about PCOS. So a few of our patients or a few of the clients that came by today had some specific women's health topics that they put, and this was our top topic that we have questions on. So again, I'm Dr. Tochi Keeton, a board certified OBGYN and obesity medicine physician. Of course, this is not medical advice, but just strictly for informational purposes. So I just wanted to share a little bit about the disease of PCOS. Hopefully y'all can see the screen okay, and if you can, I'm going to read it anyway, so you'll be fine, so don't worry about it. So I'm going to go over some of the topics that we talked about today. So top topic that we talked about today was PCOS, or Polycystic Ovarian Syndrome, and how is Polycystic Ovarian Syndrome diagnosed. So if I had a patient that came in that had some of these clinical findings, I may be suspicious of Polycystic Ovarian Syndrome. But I do know that a lot of patients have probably heard of the term PCOS, or some people call it PCOS, and they come in and they ask me, well, do I have PCOS? Do I have PCOS? So here's what it means. If you have not heard of PCOS, I'm going to explain a little bit about what it is and why we even care. So PCOS is diagnosed clinically by increased androgen levels. So what are androgen levels? Those are like male hormones. So sometimes we can find that by lab testing, or we can see it by clinical findings. So the lab testing that we may see is increased levels of like testosterone, DHEA, which are male, what we call male or androgen hormones, that may be elevated. That may be elevated when we do lab testing. But also some patients may have clinical findings that are associated with increased androgen levels. So they may have hair growth, they may have acne. Those are the signs of androgen symptoms. They may also have anovulation, so that means that they may not be having periods, or they may have what we call ovulatory cycles. So their periods may be stretched out. Maybe they might have bleeding 1 month and then not have bleeding again for 2 or 3 months. So that's what we call elevated androgen levels. So that can be associated with PCOS. Sorry, we're trying to get things kind of sorted out, so I apologize. So PCOS, again, we have some clinical findings. So the first thing, they have to have at least 2 of these. So a patient has to have at least 2 out of these 3 findings. So either increased androgen levels, which I talked about, male hormone levels, or anovulation, which is when your periods are either non-existent or they're stretched out and they're not in that regular monthly cycle. Or they could have polycystic ovaries. So we may do an ultrasound and find out that they have multiple cysts in their ovaries, and there's very specific criteria for that. Another thing that some people sometimes forget is increased AMH, which is a level that we can check, anti-Müllerian hormone, which is a level we can check during laboratory tests. So let's say I was somewhere where I could not check labs on a patient. Clinically, I could make the diagnosis of PCOS based on increased androgen from the clinical symptoms like hair growth, facial hair growth, or male pattern baldness, or acne, or irregular cycles. So I don't even have to do labs to diagnose PCOS clinically on a patient. And so those are some of the things that I may find. We can also diagnose PCOS in adolescents, and you do have to have these 2 specifically. But in adults, you can have any of these 3, but you have to have 2 out of 3 findings. Okay, what are some of the clinical symptoms that patients may come in with when they have PCOS? Again, we talked about male pattern baldness, or facial hair growth, or hair growth that's increased, we call hirsutism. They may have acne, they could have irregular periods, or sometimes patients come in because they struggle with infertility, and that's how they find out that they have PCOS. All right, so that's there. Okay, so laboratory findings. So some patients may have insulin resistance. This is deceiving here because there's not really a laboratory test that's specific for insulin resistance, but they may have like pre-diabetes or frank diabetes. They also may have increased lipid panels, so they may have high cholesterol when we check their lab panel. Also, patients with PCOS may have a predisposition to type 2 diabetes and also increased risk of heart disease. So that's what we might find when we do clinical testing. What are the treatment options? So it depends really clinically on what findings out of those things that I mentioned that the patient has. So maybe they have the issues with the acne, they may have the issues with their periods, or they may have issues with infertility. So it really depends on what clinical presentation they have as far as how I treat them. But a cornerstone of treatment is lifestyle modification. So that includes diet, exercise, and weight loss for patients who are struggling with obesity. So that could be weight loss, like clinical weight loss via exercise or diet or nutrition counseling. But patients may also have an indication for us to do medical management, right? So medical management depends on what symptoms the patients are having. So one thing that we use for medical management of patients with PCOS is oral contraceptives or birth control pills. So they can help patients with a number of the symptoms that they have. It may help regulate their periods. It may also help with acne or facial hair growth by blocking some of those increased androgen levels that they have. So also we may use direct anti-androgen medications as well. It really depends on what the clinical finding is and what we're trying to target to treat. So that's why the treatment of PCOS really deserves a multidisciplinary approach, right? So I may be seeing them as a gynecologist to evaluate some of the menstrual issues that they have. For patients who have severe endocrine issues, I may have to refer them to an endocrinologist. I may have a dietitian seeing those patients for nutrition counseling. So it really warrants a multidisciplinary approach. All right. So why do we even care about PCOS? I know, patients come in and they say, well, I've been struggling with PCOS. So there are several reasons why we should really be treating patients with PCOS with the respect that it deserves. So PCOS can increase your risk of endometrial cancer. So some patients with PCOS may have increased estrogen levels. Unopposed estrogen is what we call it, where their uterus, their endometrial lining is constantly being stimulated by estrogen and not having that slewing effect from progesterone, for example. So those patients are at increased risk for endometrial cancer. Also, PCOS patients also have an increased risk of depression, anxiety, and sleep apnea. So it really warrants for us to treat it from a multidisciplinary approach to make sure that we're treating these patients so that these clinical findings and these real risks are addressed. So that's why we care. So here's a little short discussion about PCOS and why PCOS is an important disease for us to address. This is one of the topics that we talked about today during the Women's Health Expo. Some patients came by and they kind of gave me some symptoms and some women's health topics that they really wanted answers to, and we had these discussions with them. So this is, this is just a brief discussion that I did today, but this is pretty typical of what we do during our patient appointments. So if I have a patient who comes in to see me in my clinic at HealthWise, I don't schedule 15-minute appointments, so I may be able to see them for longer visits. I usually schedule them for longer visits, so I'm able to see them and really talk about topics that are important to them. So whether we're talking about fibroids, abnormal periods, PCOS, fertility, depression, anxiety, cervical cancer, breast cancer screening, we have time to explain. I sometimes draw these little diagrams and go through these little points with my patients and share the information. And if it's something that we don't touch on during their office visit, they're able to ask me questions. So they can text me on an app that we use. They can schedule follow-up appointments. It's not really difficult for them to get scheduled for appointments and get to the bottom of their questions. So just wanted to share a little bit about some of the topics that we talked about. So if you all are interested in more discussions and more lectures on women's health related topics, just comment and let me know what topics you want us to talk about. But we're getting ready to wrap up here at the Women's Expo, and nice to meet y'all. Y'all take care. So we met a lot of great people, made some great connections here at the Women's Health Expo. And I apologize if you're making comments. I can't see the comments right now, but I'll try to hop back on and answer the questions in the comments. But if you have certain topics that you want me to talk about, if you want me to expand a little bit about PCOS, just reach out and let me know what all you want to talk about. But we're going to sign off now from the Central Arkansas Women's Expo. It's been a great weekend discussing women's health and really getting to meet some of the people here in Little Rock at the State Fairgrounds. So y'all take care. I'm going to log off now.
Charm that's on it. Let us know and come on over and pick it up. It's down in front of the from today. We also have